House leadership pushing for a fast vote on health care, but are lawmakers ready?
Let's talk to two of them, Republican John Shadegg of Arizona and Democrat Anthony Weiner of New York, who have exactly the same suit on for some reason. But other than that, they're completely different in their views.
And his hair is a lot better than mine.
Oh, all right. He's got a good hair day going here. Well, let's talk to you, Mr. Good Hair Day, Congressman Shadegg. The bill that Nancy Pelosi came out with is moving very fast. Is it moving too fast, you think, to be voted on this weekend?
Well, she'll schedule the vote. This is the bill. She'll schedule the vote whenever she thinks she has the votes to pass it. Many Americans think it's moving too fast for them to absorb. I think the issue is it covers too much. Quite frankly, I think we should have taken this issue apart into pieces, solved, for example, the issue of pre-existing conditions, solved, for example, the issue of people who don't have access to care at all, and done it in pieces. I don't think we should be taking away the health care that some people like. And yet, in the language of this bill, if you have a plan right now, it will be gone in 2 years if you bought it in the individual market. It will be gone in 5 years at most if you're getting group health care. I think that's more than the American people can swallow in the amount of time they have to look at this issue.
And Congressman Weiner, how do you pay for it? You know, how can the Dems say it doesn't add to the deficit when the CBO says that the plan pays for 6 years of program, but it's not paid for, it's paid for with a decade of tax revenues. So how do you square that?
Well, are we going to just let the 5 or 6 things that Mr. Shadegg said that were wrong? Frankly, if you, right now, 17,000 Americans are losing health insurance every day because they can't afford it. We know, for example, we're all paying too many taxes in Arizona, too many in New York to cover these people that are getting health care but have no insurance. The status quo will bankrupt us. That's a given. Now, how it gets paid for is simple. Competition and choice. If you don't like that concept, then you are not going to like the Democratic bill. And maybe you're going to like the bill the Republicans produced yesterday. After months and months of complaining we're moving too quickly, finally, 48 hours before we vote on the bill, they turned their 2-page press release into a compilation of things they could have passed when they were in charge. We're trying to do something here because the American people can't afford the status quo.
But there are so many things in it, Congressman Shadegg. That's the problem. You have 2,000 pages to address something that, frankly, there are about 4 or 5 things that need to be addressed that we all agree on. Hasn't it become a grab bag of stuff?
I think that the important thing to talk about is, in concept, I think Congressman Weiner and I agree, competition and choice are the keys. Indeed, the insurance companies in America today don't compete for our business as individuals. And because they don't have to compete for our business, because we can't hire them, they're hired by our employer, we don't have choice. I think actually the issue of cost control and the issue of how much this bill costs is the single most important issue. The reason they say it doesn't add a dime to the deficit, and I think that's ridiculous, is it raises $752 billion in taxes. I agree with Anthony. Competition and choice is the answer. We need to make America's healthcare insurance providers and healthcare providers, the docs and the hospitals, compete for our business. Unfortunately, they don't do that under this bill. But we ought to be solving these problems, and it's a good idea that we're working at it. We just don't need this answer, which I think will neither give us competition nor choice.
Congressman Weiner, you want to respond?
Well, look, the health insurance industry loves Congressman Shadegg and his colleagues' plans.
Actually, they love this bill.
Because they say, frankly, they want to raise rates 111% according to their very own estimates. The fact of the matter is there are people who benefit from the inefficiencies right now. There are health insurance lobbyists and health insurance employees. But the question is, who are we supposed to be here fighting for? I'm here fighting for the taxpayers, not shareholders of insurance companies. We have to get those costs under control.
Gentlemen, we've got breaking news. Anthony Weiner, who could have been the mayor of New York, by the way, who's now a congressman from New York, and John Shadegg of Arizona. Thank you, gentlemen.